was Typhoid Mary? Mary Mallon, nicknamed Typhoid Mary, was a healthy carrier of Salmonella Typhi, the bacteria that causes typhoid fever. She was the first person in the United States identified as an asymptomatic carrier of this bacterium. Despite not showing symptoms herself, she spread the disease to others through her work as a cook. What disease did Mary Mallon have? Mary Mallon, nicknamed Typhoid Mary, was an asymptomatic carrier of typhoid fever, caused by the bacterium Salmonella Typhi. She was a healthy carrier, meaning she harbored the bacteria and could transmit it to others without experiencing symptoms herself. Mary Mallon was born in Ireland in 1869 and emigrated to the United States in 1884. She initially worked as a domestic servant and later became a cook for wealthy families in the New York area. Between 1900 and 1907, several families she worked for experienced typhoid fever outbreaks. A sanitation engineer, George Soper, investigated these outbreaks and identified Mary as the common link. Soper published his findings on June 15, 1907, in the Journal of the American Medical Association. He wrote, "It was found that the family changed cooks on August 4. This was about 3 weeks before the typhoid epidemic broke out. The new cook, Mallon, remained in the family only a short time and left about 3 weeks after the outbreak occurred. Mallon was described as an Irish woman about 40 years of age, tall, heavy, single. She seemed to be in perfect health." On March 19, 1907, Mallon was sentenced to quarantine on North Brother Island. While quarantined, she gave stool and urine samples 3 times per week. Authorities suggested removing her gallbladder, but she refused because she claimed she did not believe she carried the disease. They suggested it because the gallbladder serves as a reservoir for Salmonella Typhi in chronic carriers, who can shed the bacteria in their feces, potentially spreading the infection to others. At the time, gallbladder removal was dangerous, and people had died from the procedure. Mallon was also unwilling to stop working as a cook, a job that earned more money for her than any other. Having no home of her own, she was always on the verge of poverty. After the publication of Soper's article in the Journal of the American Medical Association, Mallon attracted extensive media attention and received the nickname Typhoid Mary. Soper visited Mallon in quarantine, telling her he would write a book and give her part of the royalties. She angrily rejected his proposal and locked herself in the bathroom until he left. She hated that nickname. After 2 years and 11 months of Mallon's quarantine, the New York State Commissioner of Health decided that disease carriers should no longer be quarantined, and that Mallon could be freed if she agreed to stop working as a cook and take reasonable efforts to avoid transmitting typhoid to others. On February 19, 1910, Mallon said she was prepared to change her occupation, that of a cook, and she was released from quarantine and returned to the mainland. Upon her release, Mallon was given a job as a laundry worker which paid less than cooking, $20 per month instead of $50. After several unsuccessful years, she started cooking again. She used fake surnames like Breshoff or Brown, and accepted jobs as a cook against the explicit instructions of health authorities. Almost everywhere she worked, there were outbreaks of typhoid. However, she changed jobs frequently, and Soper was unable to find her. In 1915, Mallon started working at Sloan Hospital for Women in New York City. Soon 25 people were infected, and 2 died. The chief obstetrician, Edward B. Krajin, called Soper and asked him to help in the investigation. Soper identified Mallon from the servants' verbal descriptions and also by her handwriting. Mallon fled again, but the police were able to find and arrest her when she took food to a friend on Long Island. Mallon was returned to quarantine on North Brother Island on March 27, 1915. She was then permanently quarantined on North Brother Island, where she remained until her death in 1938.